Today we're going to be talking about McKenzie's exercises. McKenzie's exercises are going to be used when we have an acute injury to our low back discs. So when we do McKenzie's exercises, we're going to be laying down on a flat surface, preferably some sort of harder surface like this table. But if you have to do it on your bed, that's okay, that will work. But essentially what we're going to be doing is almost like a mini push-up, okay? So the key here is we're going to start with our chest on the table or on the floor, and we're going to just slowly do a small push-up, okay? We want to make sure that we're keeping our hips on the table, and we want to do about 10 reps. Something important to know is that the first rep that you're going to do is going to really ignite the pain or the symptoms. So you're going to start to feel that low back pain flare up, but as you go through the rest of the repetitions, it's going to slowly start to diminish. So this is what it will kind of look like, okay? Just up, that's 1, 2, 3, and you'll do that about 10 times, okay? And then you could just rest, and you're gonna do that again until the pain is gone, okay? When you're in our office, we're gonna do 10 reps, and we're gonna give you a rest, and you're gonna continue to do 10 reps until your pain level is all the way down to a 0. So like I mentioned, when you're in our office, you're gonna be doing 10 reps until that pain level gets all the way down to 0. However, when you get home, your homework is gonna be to make sure you're doing 3 sets of 10 every hour that you're awake throughout the day, okay? Now, doing 3 sets of 10 every hour is gonna take about 10 pounds of pressure off of that spine, off of that disc, so it's gonna really help to improve that. Now, if you don't have access to a table or some sort of platform that you can lay down on, the next best option is to find a counter that's about your waist high, okay? You're gonna wanna get up against it, and you're gonna wanna just extend your low back over that counter, okay? We're still gonna do the same thing, about 10 reps, 3 times every hour you're awake, except just know that this is only gonna take about 5 pounds of pressure off your spine, so it is better if we can do the lying flat McKenzie's, but if you can't tolerate that, then this will do. Okay, and then the last thing that we want to talk about is getting up and getting down from a seated position. So pretty much when we have these injuries to our low back disc, the worst thing that we can do is be in this flex position. So typically when we get up from tables, right, our tendency is to kind of lean forward like that, and we don't want to do that. We want to make sure we're keeping a very neutral spine. The best way that we could do that is to imagine that you're in a small skirt and that you're trying not to show anyone what's going on, right? So you want to kind of slide off the edge of the table, get one of your glutes off of the edge of the table, and then you're going to keep a neutral spine and just push yourself up from there. It'll be the same thing when you're going to sit back down. You want to just try to sit neutral spine, one cheek onto the table, and then you can go ahead and scoot yourself back. I'll show you from this angle as well. We would want to slide halfway off the table, and then we can just push ourselves up from that position.